For people dealing with heart conditions, there's good news. There's a brand new procedure here at St. Vincent's East, just started in January. It's called Therapeutic Hypothermia. It deals with cooling the body after a heart attack. And Dr. Jason Thompson is the team leader.
Essentially what happens, someone arrests in the field, and if they remain comatose after we get their rhythm back and their blood pressure back, then they become a candidate for this procedure. And so they come in the emergency room, and in the emergency room almost immediately they begin to pack the body in ice. And so they pack the body in ice, they infuse cold saline, essentially just IV fluid that's been kept in a refrigerator. And then they sandwich the body between cooling blankets. And so in doing this you can drop body temperature. And so they're held at that temperature, 32 to 34 degrees, for about 24 hours. And then after 24 hours you rewarm them and you can begin to assess neurologic function. You know, we all see and have seen for years people come in after arrest, you deal with a rhythm, you deal with a plumbing problem or a blockage in their artery if you have it, only to watch them sit on a ventilator and for us to withdraw care a week later because they have no brain activity. And it's very frustrating. It's very frustrating, heartbreaking. And so when you start to cool these folks and you see them walk out of the hospital, the response on the staff, it's phenomenal. You know, it's phenomenal. And you know, and then on the part of the families and the patients as well. Our first patient here at St. Vincent's East essentially arrested in the parking lot. And you know, when you arrest in a parking lot of a hospital, quite frankly, you might as well be 10 miles away because it takes a little bit to get out there. You don't have power. There's some barriers because we're not used to taking care of people in parking lots, right? And so he was down a fair amount of time, and you know, we brought him in the emergency room. We started the protocol. He came to the cath lab. He had a blockage in one of his arteries. We opened that blockage, and that dealt with the heart attack part of this and the rhythm part of this. And then what we were left with is the brain, which was going to drive his mortality, to be completely honest. And so we got him upstairs, cooled him, and I have seen him now 3 times in clinic and follow-up. He's doing fine. He has no residual, and he's back doing what he was doing. Essentially, they come in the emergency room, and the point is to cool them down. And so we do it here with a variety of different things. So we use ice packs and put ice packs under their axilla and around their neck and their groin. We sandwich them in these blankets, and so a blanket below the patient, blanket above the patient. And then the last thing we do, and it's probably the most effective, at least at induction, is cold saline. So some of the saline is kept in a freezer, and essentially we infuse cold saline. And so we've been able to get body temperature down within probably 30 minutes to an hour to the set point.
So something as simple as ice and a cooling blanket can help save lives. You can bet that Dr. Thompson's patients think he's pretty cool for introducing it here at St. Vincent's East. I'm Brenda LeDunn, and together we can conquer our health issues.
I believe we're stronger together than we are alone.
I believe we can make a difference.
I believe every day is the gift from God.
I believe in a strong community.
I believe every one of us is important.
I believe.
I believe.
I believe.
I believe we're stronger together.
St. Vincent's Health System is now 5 locations strong, including St. Vincent's 119 Health and Wellness. St. Vincent's Health System. Care you can believe in.